Happy Cell, Sad Cell, a children's book perspective of patient care. The idea behind this presentation is to simplify some often overcomplicated concepts when it comes to dealing with patient care. Shock. What does that mean, shock? And somebody says on television or in the movies, they'll say, the patient's going into shock, and it's like a switch has been flipped and everybody runs with a sense of urgency and panic. But what does that really mean? Do patients just at a flip of a switch go into a state of shock? And we're not really sure what is that. Well, shock is defined as the body's inability to circulate blood adequately to the body's cells to supply them with oxygen and nutrients, which is also a life-threatening condition. So this is also known as hypoperfusion. This definition is taken from the EMT text Emergency Care, 14th edition from Pearson Education. This is a really good example for what does shock mean, but that seems still yet a bit overcomplicated. So let's talk about this on a more simplified level. Let's start by talking about the happy cell and what makes a cell happy. So what makes a cell happy is that it gets the stuff that it wants and it can get rid of the stuff that it doesn't want. And this doesn't have to be a crazy idea. There's a lot of things that the cells need and that they want to get and get rid of. But the idea is simple. If it gets the things that it wants and can get rid of the things that it doesn't want, the cell is happy. And this can be applied to any cell in the body, and each cell may have specific needs or wants, but if the cell's getting the things that it needs and wants, then it stays happy. So in contrast to the happy cell, we can imagine that the sad cell is the opposite. So the cell isn't able to get the things that it wants or needs, or it can't get rid of the stuff that it doesn't want. So this could be caused by a lot of different things, but the idea is simple. These cells are sad because of this inability to get the things that it wants, or just can't get rid of the stuff that it doesn't want. So what does a cell want? Well, first, the cell wants the blood supply. So this acts as the transportation for bringing in the things that it wants and getting rid of the things that it doesn't. So it likes having this transportation system. You can think of this as a train. It's bringing things in and taking things out. Secondly, the cell wants oxygen. So it uses oxygen and it needs to get that supply in. So it needs oxygen. And lastly, it needs nutrients. Now, there are other things that cells need, but this is the very basic fundamental idea of what is it that makes the cell happy, and it wants these things. So we found out what a cell wants, but what is it that a cell doesn't want? So obviously CO2 is a big one, and there's a lot of other things that cells don't want, but this is the main thing is we got to get rid of CO2 and the cellular waste. So as it's using up the nutrients, the oxygen, and these other things, then there's waste from that, and it can't just hold all the waste, so it needs a way to get rid of those things. So those are the things that the cell wants to get rid of. So it's that simple. If a cell is getting the stuff that it wants and getting rid of the stuff that it doesn't, the cell's happy. And this can be any cell, but with this just general idea, this keeps the cells happy. So inversely, the cells who aren't getting those things, well, they're the sad cells, and we try to help these sad cells become happy again. So why is it we're so concerned with sad cells? What's going on with the sad cells? Well, when these cells are sad, they're not doing their job. So each cell in the body has a specific job, and they generally work together as a group, and they have the group of jobs that they perform together. And when the cells start to get sad, those cells don't do their job. You can think of it as going on strike. They're not happy. They're going on strike until they get the things that they want. And you can imagine that starts to become an issue, and as more and more cells start to become sad, and more cells aren't doing their job, then the job stuff starts stacking up, and then we get bigger issues, and other cells can become sad because these cells aren't doing their job. So this really can be a chain reaction, And that really becomes a problem. So that's why we want to identify which cells are sad and really help them to become happy cells again. Okay, so what can we do? And what is the role of the medical provider? So really the role of a medical provider is just use the knowledge, use the tools that you have to make the cells happy. This can be applied from the most basic first aid. Anytime you're providing, even if it's at a home, providing basic first aid, there's some cells that are sad and you're trying to make them happy. But this concept really moves through EMT, paramedics, nurses, physicians, etc. Then we're just trying to use the knowledge and the tools we have to make the cells happy. Okay, so we get the idea that there's cells that are happy and cells that are sad, but how do we apply this? So this ABC 1-2-3 method, this is a very basic and easy idea, but we can apply it to really any patient care situation. So we're all familiar with the ABCs: airway, breathing, circulation, and this still applies to this same concept of sad cell, happy cell. If we don't have the ABCs in place, then we know that cells are going to be sad. So the first idea is to make sure that the ABCs are in place and intact. Once we do that, we move on to 1, 2, 3. So 1 is to identify sad cells. 2, we need to make those sad cells happy. And 3, now we got to keep all the cells happy. So here's an example of what this might look like in a real world situation. So if a patient's having a heart attack, well, the blood supply for the cells at the heart gets blocked. So what does that mean? Well, the cells in the heart are getting sad. So we check the ABCs, make sure those look good. And then number 1, identify, okay, cells in the heart are sad. And then number 2, what can we do? What are we trained to do? What tools do we have to make those cells happy again? So this could be, for instance, we give aspirin, we give nitro, we give some supplemental oxygen. And that's helping to make the cells in the heart that are sad happy. Well, here's where number 3 comes into play. This may help temporarily, but we need to provide some care to this patient that's maybe a little bigger scale than what we're capable of doing. So we need to identify, okay, what does this patient really need? So now we need to find other people and other means to make these cells happy and keep these cells happy. So we got to identify that we got to take this patient to a hospital that can perform cardiac catheterizations and other procedures that can keep the cells of the heart happy. So we're providing the best care we can and identifying that there's more things that need to be done. And that's really where keeping those cells happy come into play. So sometimes when we're taking care of patients, we get into situations where we're really not sure what to do. And this can feel a bit overwhelming because a lot of times these patients have a lot of things going on and things can be very distracting where we're not even really sure where to start with our patient care. So that's where the focus on that ABC 1, 2, 3 concept really does come into play. So using the ABC 1, 2, 3 method, we can really apply this to the patient that we're not sure what direction to go or what's going on. And we know that once we get the ABCs under control, we can start looking into identifying the sad cells. And really, across the entire spectrum of care providers, the skill is in patient assessment. And that's why this assessment is so important, is we have to be able to identify what part of the body systems are affected. So we can really teach anybody how to perform these skills. The general idea is that we have to know when to provide these skills or perform these procedures to a patient. Now, if we find somebody who's having chest pain, but they're talking to us, they're breathing, we wouldn't hold them down and do CPR, right? Well, we can teach basically anybody how to do CPR, but we need to identify when is that appropriate for this patient, and we can apply that same idea to all of our procedures or skills. The real focus needs to be on identifying where these sad cells are. Once we do that, we start applying these things that we know how to do, so our knowledge and our tools to make those sad cells happy. And that really is the skill for all medical providers, and then keeping those cells happy. So instead of getting lost or trapped in this unknown circle that we just don't know how to care for these patients, just stop, back it up, ABC, 1, 2, 3, and we can kind of get on a better path and provide better patient care. I hope that this presentation on sad cell, happy cell has maybe simplified some really complicated ideas and can provide some help for guiding you on how to take care of patients. And I really think that this fundamental idea can be applied to any patient demographic. So just don't get too focused or wrapped around the complicated patients. Just break it down and simplify it and understand sometimes cells get sad, and we need to do what we can to make those cells happy.